Today I'm going to talk about the best treatments for low back pain. Obviously, surgery should be the last treatment for low back pain, but there are many things that can be done to help your low back function, heal, and in general feel better on a day-to-day basis. Hi, I'm Dr. Paul Lieber from Regenexx Pittsburgh. Anyhow, we know that over 90% of people with lumbar herniated discs that are symptomatic don't require lumbar spine surgery. And they may go to a surgeon first, and the surgeon may recommend surgery, but that's not necessarily what's needed. Over the course of time, discs do naturally reabsorb and pressure is taken off the nerves. Traditional treatment as it relates to spine care can put a Band-Aid on an injury to the disc causing sciatica, whereby injecting a steroid can reduce the inflammation temporarily. But I tell my patients, you may win the battle, but you haven't necessarily won the war. The war basically is that a disc, like a jelly-filled donut, has jelly on the inside and is firm, fibrous on the outside. If the jelly squirts out, that firm disc that was firm becomes like a deflated pillow, and that spinal segment between the vertebral bodies and the disc becomes sloppy. And so by treating the problem traditionally with steroid, you may reduce the inflammation on the nerve temporarily, but you're not solving the problem, getting the person better. This is assuming, of course, that the exercises and the ibuprofen and all of the other muscle relaxants, things like that, have been ineffective in treating the patient, because oftentimes people will get better on their own without needing a specialist. But when you do need a specialist, we at Regenexx Pittsburgh treat the spine differently. We treat the spine using your blood platelets and using platelet lysate to heal tissue, nerves, and discs in a comprehensive, concerted way, where we'll inject ligaments, we'll inject facet joints, which are the two joints in the back of the spine that can act up. We can inject joints and we can inject nerves. And in so doing, we can solve the spinal segment problem and give somebody a long-term pain relief. And it really doesn't matter whether it's spinal stenosis or a herniated disc with sciatica or a sprained ligament. The treatment is similar in treating the segment comprehensively and in a concerted manner. And this does involve several different injections, not one injection. Usually it can be done over the course of 45 minutes or so. So I'm finishing with this video. I will be talking about walking and how it will help low back pain in the next video. Please tune in to that video.